Well, good evening, everyone. I think we'll get started now. We're just after 6 o'clock. Very pleased that we have 61 people with us this evening. Um, just as we get started, I'd like to begin this meeting with an acknowledgement of the land that we're on. As we gather today, we acknowledge this land, the people and all other beings, animate and inanimate, as well as the ancestors. This area has been a place of communities coming together for well over 15,000 years. This land has been the territory of the Huron-Wendat and the Petun Nations, the Seneca, and most recently, the Mississaugas of the Credit First Nation. The territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Confederacy of the Ojibwe and the Allied Nations to peaceably share and care for the resources around the Great Lakes. Today, the meeting place of Toronto is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work in this community. We are also mindful of the broken covenants and the need to strive to make right with all our relations, sharing stories and telling the truth of this place. So good evening again, and thank you for joining us. Welcome to our town hall. My name is Dr. Tim Rutledge. I'm the president and CEO of Unity Health Toronto. And on behalf of Unity Health Toronto, I want to welcome you to this very important information sharing session. We see this as an important opportunity because it is our first touch point with our valued neighbors on our vision for the future of seniors' health and long-term care programming at Providence Healthcare. Providence is a pillar in our community, your community, and we want to make sure that you know about what we're planning at this early stage. You'll notice when you signed in that we're recording this session, and that's to allow us to review your input. And we also plan to post this recording on our Unity Health website for those who wish to view this town hall at a time that is convenient to them. So we have a rather full agenda this evening. I'm going to provide a brief overview of Providence and a little bit of information about our vision. We are very pleased to have with us this evening City Councillor Gary Crawford, who will walk through this important investment in our community. Melissa Mori-Hollis is our Vice President of Clinical Programs at Providence, and she will provide more details about our vision for this site and the construction of our campus of care. And then Sabrina DeVille, our Executive Director of Communications and our Chief Communications Officer at Unity Health, will speak to you about how we plan to continue to keep you posted about this project. And then we're going to have an opportunity for an open forum to address your questions. And we have a number of members of our team here that will be able to answer all your questions. So I am going to ask you to hold your questions until we get to the question and answer period. So without further ado, let's get started. For those of you who don't know us particularly well, Unity Health Toronto is a network of 3 hospitals across Toronto. Providence Health in the east, which I know you're familiar with, St. Michael's Hospital downtown, and St. Joseph's Health Centre in the west end of Toronto. The strength of our network is the spectrum of care that we offer. And of course, Providence Healthcare provides a key role in providing compassionate and excellent long-term care, rehabilitation, and palliative services to our patients, residents, and clients. The people of Providence Healthcare live and breathe our vision of the best care experiences created together. Today, you're going to learn about a project that we're all really excited about, and that will help ensure that we can continue to lead the way and continue to walk hand in hand with our community as we create those best care experiences together. In late 2019, the provincial government put out a call to build additional long-term care capacity in Ontario. And we enthusiastically put forth an application which became the foundation of a much bigger vision for our campus in the East End. A vision of what Providence Healthcare can become beyond just adding more long-term care capacity. We are very fortunate to have the physical space to grow right on this campus. And while we first thought of this work before the COVID-19 pandemic, what transpired during the pandemic made our resolve even stronger. Our ability to safely manage long-term care during this time was acknowledged by the province when we were asked to help support the COVID response at a number of long-term care and retirement homes across the city. This is a direct reflection of the long history of quality care in long-term care through the Cardinal Ambrosic Houses of Providence, which opened 20 years ago. We've weathered the COVID-19 pandemic very well and demonstrated the special expertise we were able to mobilize from across Unity Health. We are nimble and responsive, and this is one of the hallmarks of Providence. That's why Providence was one of the first rehabilitation facilities to have a dedicated COVID-19 unit in Canada, and now a COVID-19 recovered outpatient rehabilitation program. Our work has been shared nationally with other providers who are modeling after what we have developed here. We want to ensure that these learnings are integrated into what we build, which is the future of long-term care and seniors care for our community. Ultimately, our goal today is to share with you how we want to build for the future for our and your community. So I know there's lots to discuss today, so I'm going to wind down by once again thanking each one of you for taking time this evening to be engaged and informed about your community. We feel that Providence is a very special place, certainly a treasure in Unity Health, and a treasure in the East End of Toronto, such an important part of our city. There are so many healthcare providers here and neighbors who care, and importantly, residents who need us. We're proud of our roots in your community and grateful for the time you are taking tonight to learn about what we plan to accomplish. So I look forward to hearing from you and hear our rich conversations this evening and to get to know you all a little better. And so now it is my pleasure to turn it over to our City Councillor, Barry Crawford. Barry, over to you.
Dr. Rutledge, thank you very much for coming out tonight and your entire team for the great presentation. I'm sure that's going to be happening. I just want to thank everybody for coming out tonight to learn more, as Dr. Rutledge said, about the future of Providence Healthcare, and to thank, of course, our hosts, everyone online for the discussion we're going to have. As you know, Providence is an incredibly important part of Scarborough Southwest, and not only that, but also in the east part of Toronto. They're a valued asset that has been here, and for some of you who've been in the community a long time, know that they've been in here for 60 years, and that they're a leader in rehabilitation, palliative care, long-term care, and community care. So I'm really excited to hear more about this vision for the Center of Excellence for Rehabilitation. Try that again. Rehabilitation science and health living with enhanced and expanded services. It's been a long day, Tim. And you're going to be hearing a lot about campus of care, as I think Dr. Rutledge has mentioned. And that's an important part of what they're trying to do here is this full campus of care, and as Tim said, they have the space and they're looking to utilize that. So I'm really looking to see how you're going to make this gem of Scarborough Southwest and East Toronto better than it actually is, because what you do and what you provide to this community and greater community, of course, is just phenomenal. I've had the opportunity to be there a number of times, and every time I go in there, I'm just blown away by the excellence that I see and the care that you and the staff and the entire team do for the people and residents who use these services. So I'll leave it at that. I'm looking forward to, again, I've seen a bit of a preview on what to expect here tonight, and I think the community is going to be quite pleased, quite impressed with the work that you've been doing behind the scenes to present this new vision for Providence. So again, thank you very much for having me tonight, and I'm looking forward to the conversation.
So maybe I'll pick it up from there. Thank you so much. My name is Melissa Morey-Hollis. I'm Vice President Clinical Services here at Providence at Unity Health, and it's our great pleasure to be here today. Thank you for such a wonderful introduction. And as I said, we're very excited to share our vision. What we're hoping to do today is give you that key information about our project. We want to keep you informed right at the start of this work. And when we get to the end of my part of the presentation, we're going to hand over to Sabrina, who's going to speak to us about determining the best ways for us to keep in touch. So as Tim said, in late 2019, we answered the call to apply for additional long-term care beds in the system. And we knew this was an important step for us at Providence to take because we know that we need to support long-term care. However, we also realized that this was an opportunity for us to think a little bit differently about how Providence could support the system and the role that we wanted to develop in the upcoming years. So as part of this work, we developed our vision of becoming a center of excellence for rehabilitation science and healthy living. And this is really where we started our journey. Our work is always grounded in the values of Unity Health: community, excellence, compassion, human dignity, and inclusivity. And our values really guide how we serve our community. We're pleased to share that when we submitted our application on March 1st of 2020, on March 18th of 2021, we did receive approval to add 180 long-term care beds to our campus. And so we're going to talk a little bit about that tonight as well. So Unity Health is a very large organization spanning from the west end of Toronto right through to the east end of Toronto. And you can see how big the catchment area is for Providence. We certainly take patients from across the city, often from the north as well, but we do have a really large catchment area. And because Providence is part of Unity, we have access to services and expertise that we can call upon. And what this means for us is that we can take patients and residents who might have higher needs than you would normally see in a standalone rehabilitation center. And this is really important when we start to think about building out a campus of care and the services that our clients and our residents are going to need. So we wanted to tell you a little bit about Providence by the numbers. So we are a rehabilitation and complex care hospital, and we have a very large long-term care program that sits on our campus as well. We have 230 rehab and complex care beds. We have 288 long-term care beds. We see over 3,000 inpatients and 2,300 outpatients every year. Providence also is known for admitting the most complex rehab patients in the city. So those patients come to us with the lowest functional measures, meaning that they're at their lowest functional level, and they actually leave here with the highest functional level in the city. And what this means is that our teams are very effective, and they're able to use research and education to help get the best outcomes for our patients. 85% of our patients are also discharged home from the city, which is really important because that means that our patients can return to where they live and don't often have to seek out extra or different places or services. We have a lot of expertise at Providence. We actually kind of have 4 pillars that we've set up. Today, we're going to talk about the Seniors Health Program, which includes some geriatric rehab, assess and restore, community outreach, and our adult day program. We also have a very strong rehab program, which includes stroke and neuro rehabilitation, orthopedic and amputee clinics, and some general medicine rehabilitation programming. We also have a large palliative care program, and as I said, our long-term care program. And these services help to position us to create a campus of care here at Providence. We have 21 acres, so we are a very large facility. And with all of these different services, what we want to do is start to build a service model around our patients and their families to help them stay with us and transition through the aging process and through any sort of disease continuum that they might have. A campus of care is a way of building different service levels that help people to stay with us, and instead of aging in place, help them to live in place. And what you see on the screen now is a picture of how we envision this. So with our patients and families in the center, looking at expanding our primary home visiting team, looking at retail, looking at adding some specialized geriatric services, looking at how we partner with community agencies and patient life solutions. So expanding all of those services across not only our campus, but out into the community as well. When we do this, we'd like to further embed research here at Providence and start to look at education a little bit differently, perhaps adding a living classroom here to the site where our students can come and learn here as well as do their placements here. So as we're creating this campus, there's two things that we're going to start to focus on. The first is developing our world-class seniors health program, and the second is the expansion of our long-term care program. What you see here is a list of the services that we currently provide for our seniors. Just a few highlights for you. We have our inpatient geriatric and medical rehabilitation program. This is a 66-bed program that goes across 2 of our inpatient units and actually takes patients directly from the community who might require some rehabilitation. These units specialize in rehabilitation for an older adult population. And on our admission data notes that we've had over 940 admissions in 2019 and 2020. We also have a very large outpatient therapy clinic and access to a patient access and flow team. This ensures that we have strong linkages between our inpatient outpatient program, as well as robust connections, both upstream to the people who refer to us and downstream through the programs such as our community health navigators who help to engage in post-discharge calls and check-ins. Our regional geriatric program specialized geriatric services are outlined here on the right and include a geriatric medicine clinic, a falls prevention clinic, geriatric psychiatry clinic, and community outreach services. We're also very proud of our enhanced adult day program, and it's a standout adult day program across our community partners because it also includes a caregiver respite program with 7-day consecutive overnight stays. So what we'd really like to talk about as well is the 180 long-term care beds and how the campus of care fits the services into a new building that we are looking at here on campus. What you're seeing in front of you is an aerial of the Providence site, and where you see the yellow dotted line is what we call our K-wing, which is one of our oldest buildings here on site. What we're proposing and what our project envisions is a new building to replace the K-wing that would house our long-term care beds as well as our services for seniors' health. And if we go to our next slide, Anna, we just want to orient you to what this looks like. So for those of you that have been to our campus before, you'll know that on the bottom right, we have our outpatient clinics. On the top left, we have our current houses of Providence. You'll see in the center of the campus where the K-wing would come down and an artist rendering of what a building could look like. And beside that, something we're very excited about, our new winter garden, which is a therapeutic space that will be covered and will allow us to do activities all year round. Will also serve as a hub and kind of the center of the campus. And so we're very excited about that because it allows us to create programming that's a little bit different than what we have right now. And we think will really contribute to a home-like environment for our residents here on site. So we have already started some internal engagement sessions around our concept and have met with over 140 of our partners or users of our current service. These include our long-term care residents, our patients and their families, physician and staff, as well as community partners and colleagues. Their input has helped to inform our vision and programming in our early development stage. What we've heard is that for seniors' health, we'd like to expand our range of services and really look to enhance care in the community. We want to increase awareness of the programming that we already have and really be sure that our patients and residents are involved in our planning. From the long-term care side, we heard that access to technology is very important for our residents. Designing spaces along with our residents so they have a lot of input into what their homes look like, and including a lot of private spaces, spiritual spaces, and green spaces. So this has been very helpful for us as we start to think about developing out this program. So in terms of timeline and next steps, we have completed the engagement sessions as I just described. By end of day today, we will have touched base with all of you, our community. What we have in planning is a demolition of our K-wing, targeting for the fall of 2021. We're also in progress looking to hire an architect for our new build, the architect will be later into the fall. And then we're also working internally to plan out programming and firm up what the site plan looks like. So if you're wondering our timeline in all of this, it's 24 months. And we know that's aggressive, but we also know that it's really important that we get these services up and running and we get these beds out for our community because they're a very important part of the care that we provide. So with that, I'm going to turn over to Sabrina.
Thanks, Melissa, and good evening, everyone. My name is Sabrina Deva. I'm the Chief Communications Officer for Unity Health Toronto. One of the goals for our meeting tonight was to make sure our community had contact information into our Providence site to help with any questions or concerns that you might have over the length of this project. And you'll see here on this slide that you can email us and call us anytime. The email address and phone number is also included on the postcard that you received in the mail for this meeting tonight. And we'd also like to hear from you as well about other ways you'd like to receive information about this project. For example, we've heard from some folks already that there's a preference for people to receive printed material in the mail from time to time. And we'll look at doing this around key milestones within our immediate neighbors. And we'll be using our website to share regular updates and look for more opportunities to get together like we are tonight. So as we move into the question and answer portion of this meeting, please feel free to use the chat function here to share ideas about how you would like to receive information from us going forward about this exciting new vision for Providence Healthcare. So with that, Tim, I'll hand things back to you to open this up for questions.
Fantastic. Well, thank you so much to Councillor Crawford and to Melissa and Sabrina for that information. We do have other members of our team here at Providence and Unity Health to take any questions you might have. And so let's open it up for questions and comments. And you know, there's a couple of ways you can pose those questions. You can push the chat button at the bottom of the Zoom and you can type in a comment or a question. And you see there's a comment there already from our comms people to talk about sharing your email address with us if you like. So you can type in your question or you can raise your hand and chat or just speak up. Just trying to think how to, yeah. So I think the way to raise your hand is you push the reactions button and there's a raise your hand button. So I'm looking around and I don't see any raised hands yet. For those of you on the phone, you can simply unmute yourself and maybe introduce yourself and go ahead and ask your question. So
Tim,
go
I
ahead.
did receive a direct question in the chat from Linda. And the question is, where are you moving the people who are in K-Wing now?
Great question. So maybe Melissa, maybe you can answer that question.
Sure, I'll get started and
that wing right now. So go ahead.
I'll get started and maybe Mike and Ron can jump in. Our K-Wing has not had patients in it for quite a number of years. It was previously used by the Sisters of St. Joseph as a residence, but it has been vacant for a number of years in terms of having people stay there. We did have some offices and we did have some storage space in the K-Wing. So what we've been doing is working on a decanting plan to get those things out of that space and into storage in another spot on our campus. But it has been a while since some patients have been in that area. I don't know if Mike or Ron have anything to add to that.
Okay, other questions, comments, ideas, hopes for this site?
Hello, my name is Carolina, and I have, I guess, a couple of questions in regards to the design, which I posed previously, and I just wondered if maybe you have some additional feedback from the team that's currently on the webinar here. I'm just curious about the design itself and how at the moment long-term care is under a microscope, and the current layouts with long corridors, shared rooms, no showers, like individual showers, also access to fresh air within each room, that sort of thing. Is that something that will be implemented into the design? And also smaller wings, like smaller communities within the long-term care residence itself, 8 to 10 individuals versus, 16 to 20. So I don't know if someone can maybe speak to that, or if that's something under review at the moment. Thank you.
Thank you, Carolina. That's a really, really important question. We have learned a lot through COVID, as you know, as a system, and certainly at Providence. I think one of the reasons we did so well at Providence is we've got quite a good physical plant right now. But you've raised a number of opportunities for improvement in future builds. Mike, do you want to start, and then anybody who wishes to add? Maybe Ashley has some thoughts on that. But Mike Keane is our Vice President of redevelopment, and so Mike, you want to start on the answer to that?
Yeah, certainly, Tim, and thank you, Carolina, for your question. I would start by saying that the design is based on the province's standard for long-term care design, which are about 6 years old at this stage. However, we are making improvements and enhancements over top of that. Certainly, we have learnings from COVID as COVID-19, as Tim has already mentioned, and we'll be incorporating some of those learnings into the design. We've had some feedback from some of our patients and families, our clinical staff who have worked through the COVID-19 pandemic as well, and have some great ideas that are already being fed back into the inputs for the design. I will also mention, and some of these, you mentioned for example, the cohorting within the facility and the opportunity that provides. And certainly we've looked at that as one of those opportunities. I will also say that our houses of Providence have design features that are slightly different than what's in the standard. And throughout the COVID-19 pandemic, our houses performed very well in supporting our efforts in containment of any outbreaks. And so we're also taking learnings from what we did in the design from 20 years ago, what was successful and what we would like to improve on. So all to say that we have yet to hire our architects that will do the final design. That is a process that's underway, as Melissa mentioned, this summer. And we will be feeding all this into the architects for the design. And certainly I'll throw it out there now that we welcome any ideas that certainly that anyone has had exposure to or learned from. We're looking at all sort of ideas to make improvements and putting that into the final design.
Thanks tons, Mike. Carolina, great question, and stay tuned, stay engaged. We definitely want to build better. As I say, we're quite proud of Providence, and we want to maintain. We want to continue to elevate the standard of care that we provide to our residents. There's a couple of clinical questions here, and so I'm going to put Melissa and Dr. Ashley Verdun on the spot here. You haven't met Ashley yet. Wave, Ashley. Dr. Ashley Verdun is our medical director at Providence and Chief of Medical Services. So great question here from Mary, and talking actually about the butterfly approach. Mary points out the global movement away from, oops, it moved on me. There we go. the global movement away from mass programming for older adults who are living in long-term care towards a more person-centered model, such as the butterfly approach from the UK. Have we been researching models of care, and what are our thoughts on that? And Ashley, if you have any thoughts specifically on the butterfly approach, I know we've talked about it, and just to reassure you all, we're constantly scanning the literature and best practices from around the world on how we can optimize care for our patients, for residents. So, Dr. Verdun, your thoughts on this?
Hi, everybody. No, these are great points. I agree actually 100% with the first comment that we need to do better in terms of our care, residents in long-term care with dementia. And the butterfly model is a model that's focused on emotion-focused care. And that is certainly a priority for us. We want our new long-term care home and our existing long-term care home to benefit from what we know is best in terms of research. And so we are certainly looking at the models of care. I see somebody else mentioned about gardening. There's actually quite a bit of evidence to support gardening, and we are incorporating a winter garden into this design. That's one thing we're very excited about. And we're really looking to all of you, and I know Carolina is going to be a part of this too as one of our family council members, in terms of what services our residents want and need and how we can really support them in terms of their quality of life. And a lot of that will have to do with our programming, but it will go all the way down to the way our staff approach care in the home.
Thanks tons, Ashley. Actually, I should have introduced Pat Colucci. Pat Colucci is our director at Providence. Pat, do you have thoughts on optimal models of care for our residents? I know you do.
Good evening, everyone, and nice to meet everybody, and so glad that you're with us, because some of the great ideas have been coming through the engagement sessions that we've done internally and with some of our families and residents. And you know, one of the comments that we got was we have to involve the residents, and they're the ones that have given us some great ideas that have just continued to inspire us. So yes, definitely a lot of talks around the butterfly model, the Eden Garden model. We've connected with the Alzheimer's Society as well to get input from them. So we're getting a lot of expert advice around the dementia strategy and what we could do better for our residents living with dementia. So, you know, no hesitation to keep the ideas coming, because it just they just keep growing and growing, which is great. So thank you.
Thanks, Pat. Let's move on to the next question. Sylvester. Sylvester understands that the services we've presented here do not replace regular healthcare. Are they related solely to seniors with or without conditions? In short, who are our clients? Maybe I'll ask Melissa to start with that one.
No, that's a great question, Sylvester, and thank you for asking that. So certainly when we started designing this model, we knew that, you know, we have patients here in our rehab and complex care beds. We have residents who are here with us who live in long-term care. We also have community members who access different services here, like our massage therapy or our chiropody. So what we're designing really isn't just for people who happen to be at Providence. It's really for the broader community when we're thinking about healthy aging and when we're thinking about living in place. So when we think about expanding services, it could be for people who currently have a medical condition, who require some support across a longer continuum, but it could also be for our seniors who are living in the community and maybe need to access an exercise program, or who want to come here to enjoy the gardens and do some walking, or maybe need to connect with or want to connect with some life services, like thinking about lawyers or thinking about finances, or even come to maybe use our pharmacy. So really we're trying to think like a member of the community and how we can provide those services for people who live near and around us.
Thanks tons, Melissa. I'm going to go with Carolyn Heath's comment now, which I love. Carolyn talks about the Riverdale Hospital. I think that refers to Bridgepoint. Am I correct? Riverdale has changed to Bridgepoint. I'm seeing a nod. Yes, just I thought that. I just wanted to make sure. And they have a rooftop garden, which I've seen. It's a flower garden full of perennials, and it's nice looking. But Carolyn's wondering, has there been any thought to a garden on our property, and maybe even some vegetables and fruits, and could be grown and incorporated into the meals people receive? Love the idea, very creative. Who wants to tackle that? Who wants to think about that?
Well, maybe I can start, Tim, and then I'm going to invite the rest of the team to step in. So it's really hard to come to our campus with our beautiful 21 acres and not think about putting gardens in, and especially vegetable gardens. So we know that we do have some fenced in areas attached to our current houses that we're looking at putting gardens within. So we've talked about doing community gardening for our residents, and possibly even for some of our members of the community, where we could do raised gardens. We certainly know that we don't have to use as many medications with patients who might have Alzheimer's or dementias if we can replace that with activities. When we're thinking about healthy living as well, I think there is an opportunity for us to look at how we could incorporate some of that back into the meals that we're doing here at Providence. I know the green rooftops are becoming very popular, and I would actually look to Mike and his team to talk a little bit about the viability of doing a green roof here for us.
Yeah, thanks, Melissa. I mean, certainly green roofs have become part of the architecture of a lot of our buildings, and the main purpose of those green roofs is an environmental impact and water retention. And so you often see those types of flower gardens, the perennials that Tim mentioned, that offer that. And I think that's very different than potentially the opportunities we might have in our winter garden or in the green spaces around Providence. And so I think we have lots of opportunity for green space in and around the facility, and for different applications.
Thanks, Mike and Melissa. I love this one from Mary. Thank you, Mary. And we're all over this. Mary says, with the increasing incidence and prevalence of dementia, it's critical to incorporate leading edge dementia specific research into best design models that support people living with dementia. Design that supports people with dementia supports everyone. Yes. And by the way, you're probably aware that Unity Health is an academic health sciences network. And we do intend to do scholarly work that would benefit those that we serve right across the network. And we will add an academic dimension to the work we do with people as they age. And we will also be very much involved in education of future healthcare professionals. We already are, and we'll get more so involved. When you're involved in research and when you're involved in education, you're constantly scanning the best practices. And I know Pat and Melissa and Ashley are very keen to incorporate the latest thoughts on dementia-specific care. I don't know, Ashley, if you want to comment on where we're at with integrating innovative new models in care for folks that are cognitively impaired.
Well, to your point, Tim, what's great about Providence and our new integration with, not really new anymore, I guess it's been almost 3 years, but our integration with St. Michael's Hospital and St. Joseph's Hospital is that we are now connected with one of the biggest and brightest research institutions in Canada. And we have a powerhouse geriatrics team that are already starting to do research in the houses of Providence and at Providence. And so we're really excited about the opportunity to really harness the research that's happening and really contribute to the body of research in the future in terms of dementia care, models of care, which we spoke about, education and training too. And I think we have a great program that Melissa's outlined that provides some excellent learning opportunities as well for physicians, nurses, PSWs, to learn in an environment where we practice best practices and are really sort of on the cutting edge of new evidence. So it's a very exciting time.
Thanks, Ashley. Carolina makes the point that, oops, it moved on me here. The Eden alternative as a model of care as seen in Sherbrooke Long-Term Care Home. Their priority is to eliminate boredom and loneliness, as well as presumably focus on person-centered care. Maybe Pat, you want to comment a little bit on what we're doing to eliminate boredom in the houses?
Yeah, so within the houses, we've done programs catered to the needs of the residents. So we've increased our one-on-ones as well as the group activities, smaller groups now with, you know, the experience of going through COVID, but the engagement of those residents is so much more meaningful with the smaller groups. And again, just catering to the individual needs of our residents and bringing in the resources for that. So we have a lot of external resources that are coming in now virtually, but we're constantly looking at different ideas. We've got you know, sessions where we play classical music for those residents that really enjoy classical music. We have pet therapy that we do with our staff, and we have simulation of different types of animals that our residents really enjoy petting, and just the calmness that it creates. So we're continuously looking at different things to bring into the houses so that we can try and develop and just encourage this engagement and reduce the loneliness. So
thanks, Ty. Folks, when I walk the halls of Providence, and in particular the houses of Providence, our long-term care facility, I'm always inspired by the activities that are going on to keep our residents entertained and occupied and engaged. And we're always open to new opportunities to enhance that.
And it's Lori, if I may. I just wanted to add one more comment.
Please do, Lori.
Thanks. Good evening, everyone. I'm Lori Brady, the Senior Clinical Program Director for Seniors Health and Ambulatory Care on the hospital side at Providence. But I just wanted to add that we do have, as part of our Seniors Health portfolio, an enhanced adult day program, as Melissa alluded to. One of the silver linings from COVID is that we had staff redeployed over into the houses. So it allows for cross-pollination, if you will, of programming support and activity between those two programs, which might serve somewhat similar patient populations who might be experiencing moderate to severe dementia. So just wanted to flag that inter-Providence programming capabilities as well.
Very glad you jumped in, Lori. Sorry, you were off my Hollywood squares here, but now you're solidly planted on it. And yes, Lori is a really important leader at Providence. And actually, Lori, it's a great segue to the next question, which is, how does Providence support the community? And how do we involve the community? So actually, let's go with the support the community first. And Lori, maybe talk a little bit about our ADP program, which I'm so proud of.
Yeah, absolutely. I think
it's on a bit of a hiatus because of COVID, but it will be rekindled for sure. Lori, over to you.
Absolutely. So I think the ADP program is one of the jewels in our crown, if you will. It's an enhanced adult day program with capabilities, not just for in-person day visits, but also we do have historically a 7-day overnight stay respite program and a caregiver support program. I would say that throughout COVID, yes, we have had some limitations in having to shut down the programming from an in-person standpoint. However, though, there has been silver linings, as I've alluded to, in terms of the indirect support that we've been able to provide from a Houses of Providence long-term care home perspective. And as well, that program has pivoted and the team members have been able to offer virtual support, virtual programming to some of our clients and residents. And so I think that's a community-based program. The clients and the caregivers are supported and stationed in the community. They're very involved in the program. And so that's a way in which we are directly supporting community members and as well allowing those learnings to really share across the campus. I'll also note, in terms of supporting and involving the community, at our Providence site, we do have quite a robust patient family council with representatives that have been included in the planning and design for this set of work around the campus of care expansion and will continue to do so. And we also make it a point to ensure that involvement and consultation at any and all of our large projects moving forward. So that voice is entrenched and woven into our planning efforts at the onset as opposed to an afterthought. My initial thoughts.
Thanks tons, Lori. And just in terms of community engagement, maybe I'll ask Sabrina or Melissa if they have anything to add on that.
I think when it comes to this project, tonight really is the start of the conversation with the community, Tim. So, you know, we are looking for suggestions on how we can engage and communicate with the community. So I really encourage everybody to please, you know, share any ideas that you have in the chat. Because we would like to incorporate that into our planning going forward. Anna on our communications team, if you scroll up way up to the top, you'll also see we've posted a link to a Survey Monkey where we're asking to collect some emails from those folks that want to stay in touch. So right now, you know, this really is an information sharing session, but we will look at ways to create some of that two-way dialogue similar to what we are doing tonight. Melissa, did you want to add any more?
Sorry, thank you. No, one little thing to add, because certainly having you be part of this is really important, but we also look to our community partners and our other service providers that we're looking to partner very closely with, because sometimes it's great to go to them and sometimes it's great to have them come to us. So the Ontario Health Team here in the East and the Ontario Health Team in Scarborough are teams that we're working very closely with and presenting this concept to see how we can knit a little bit closer so that access to services become much easier to you, the people that we serve.
It's tons, Melissa and Lori and Sabrina. Next question is a really good one that we have thought a lot about, and that is about how much to build. Mike, I'm coming to you on this, but the question is, since there's a gigantic demand for long-term care, and there certainly is, why not add a few more floors? Part of the answer is that there's a lot of long-term care development going around Toronto. This is the number that we felt made sense for us. Then the other parts of the question, what's the budget for the project and how much is funding is committed so far? You want to comment on this question, Mike?
Yes, thanks, Tim. Yes, we're currently working to finalize the details of our agreement with the Ministry of Long-Term Care and the Ministry of Health on the project. We have been allocated 180 beds for long-term care. We know that, and certainly, as you mentioned, there are a number of institutions that have been allocated long-term care beds around the Toronto area and throughout the province. And 180 is the number that's been allocated to us. That fits very well from an efficiency standpoint with the 288 beds that we currently have in our houses of Providence, and so that's what we're moving forward with in finalizing our budgets to match those 180 beds. I will say, however, that we know that there is a high demand for long-term care, and we know that there's a lot of change that happens in our healthcare environment over time, and so we like to plan for flexibility. And we will be building flexibility into our design that allows us to do future expansions should the need require and the opportunity arise.
Thanks tons, Mike. Some more comments from Carolina. Please use European precedents for design. They share a similar climate. They also design bedrooms with in-room showers and balconies and seating for families to visit just like a home. They also provide patios with sliding doors off the dining areas, as well as prepare the food on the floor. I am familiar with that model, Carolina, and have a large kitchen integrated at each home for groups of up to 10 residents. So we definitely do want to know what sort of the state of the art is and what the innovations are, Carolina, and we'll be considering all those things as we put the details on this design. Things to consider for sure. Julia asks, what's the percentage of our residents in the houses that have dementia? Ashley or Melissa or Pat?
It's 88%.
Say that again, Ashley?
88%.
Pretty high percentage. Thank you, Ashley. So, I mean, that's a growing concern in our communities and a group of individuals who require the best possible care. And so I think with that percentage of folks with cognitive impairment, you can probably appreciate that we have considerable expertise in this area and want to continue to grow that expertise. Mary, as you likely know, Dr. Pat Armstrong of York University has done and continues to do extensive work on best global practices in long-term care. Would encourage you to work with her and your exciting new venture. Thank you. Great suggestion. I'm not sure if Pat Armstrong has been much engaged to date. We're probably familiar with her writings. Ashley, did you have any comment on that? I saw you go off mute.
Yeah, you know what, I was in a talk with Pat. She's amazing. She's dedicated her life to long-term care and research in long-term care. And she actually co-authored the Royal Society report for long-term care with one of our geriatric, actually our chief of medicine, Sharon Strauss. So we're quite familiar with her work, and I know her personally now as well. So we will engage her for sure in our design plans moving forward. But that's all of that work is informing what we're doing here at Providence in terms of our design, our models of care and programming. But I'm glad you mentioned her. She's a star.
Thanks, Mary.
I'm so sorry to interrupt. There's a lady, Margaret Talbot. She's been waving at the screen. Maybe I'm sorry, in case you haven't seen her.
So how do I see that?
Yeah, that's okay.
Go ahead, Margaret.
Hi. My question is on two fronts. You're talking about the well-being of the population, and that to me means two things. One, how often are the parent, the relatives going to be able to come and park? So what is your parking going to be like? And also their spirituality. What's going to happen to that chapel?
Important questions, Margaret. Thank you for asking, and apologize for, I guess you must have had your hand up and I didn't see that. So
no, just twice. Thank you.
Apologize. So capacity, first of all, how often are they going to be able to visit? After we get this COVID thing behind us, we're absolutely going to encourage visiting, if it was up to me, round the clock. Melissa and Ashley, don't shoot me, but I think I think that would be optimal, right? Parking. Mike, I think we've got an assessment that we will have sufficient parking. We certainly have pretty good parking capacity right now. Mike, do you have any concerns around parking capacity going forward?
No, we have some good capacity now, but we're looking to expand as well. There's additional spots that are planned in and around the new facility as we develop it as part of our agreements with the city as well.
Okay, I just hope that keeps at the forefront, because I know when I have come to the center many times, bringing various people, I've always had to drop them off and park way around the corner, not near where I was actually dropping the person off. So that's why I'm suggesting that it be thought about. And then the spirituality aspect of it. At least 3 of the people that I used to take up there were very religious bound and needed a space to meditate and that kind of thing.
Yeah, really good question, Margaret. So I'm just going to touch on the parking one more and get to that key piece on spirituality. I'm not sure that we're going to be able to change the location of parking. It's wrapping around the whole property. Mm-hmm. So I might as well be honest there. There is ample parking, but you are correct. It is all the way around the property, and we're planning on building a parking tower, which, as you know, is extremely expensive. So what you've experienced is probably not going to change with this development. So apologies up front. Now, let's get to your really, really important question. I'm going to piggyback that on with Kenna's question. and that is how does Providence currently and in the future address cultural, religious, and experiential differences of long-term care residents. We know that gaps often exist. We do too, but we really try hard on this front. We have no plans to move the chapel or get rid of the chapel. It is a centerpiece for our facility, and we wish to be and strive to be sensitive to all cultural and religious backgrounds. So Melissa, maybe you want to jump in on that?
Sure, that's a great start, and I'll just piggyback on what Tim said. We don't have plans, as Tim noted, to move the chapel that's currently within the houses, nor do we have plans to do anything with the chapel that's really right now currently located in the center of the building. What we have been considering is how do we use those spaces a little more often, especially the big chapel that we do have that rarely sees a lot of people in it because it is a little bit more difficult to access. So we've been looking at accessibility into those spaces. The other thing that we've done from a multicultural perspective is we've recognized that we haven't always done the best job making sure that we have spaces for people who might want to meditate or who might have a diverse background and need to have another space that they need or would like to be in. So we're partnering with our new program director for equity, diversity, anti-racism, who's going to help us look at designing spaces that are a little bit more culturally sensitive and appropriate for our populations. We're just getting started on that work now, and we'll be sure to include leaders from within the community and our residents to help look at the spaces and how those should actually be laid out. Those might not be right within the new building because we're really trying to prioritize patient care space, but they would be adjacent to it or very close to it, and maybe look a little bit different than what we have right now. Pat and the team, I think, do a pretty good job right now of identifying any sort of needs for our residents. I don't know, Pat, if you want to add to that.
Yeah, so in the houses, we have different religious groups, religious denominations, and we, as soon as they come into us at admission, we ask how we could support them. And so we do offer services or resources to them to help them feel included and do programming around those specific groups.
Do you still offer a public service that all people could go there? The family members could take their person they're coming to visit in as well?
So currently, because of COVID, no. Right.
But on a regular basis.
Yeah, on a regular basis. We were doing that right up until COVID hit. And so I can see that going forward once we come over the COVID situation. I'm sure that that would be something that would be opened up in the chapel and areas that we would have that. For sure, we'd include families.
Okay, Naomi D'Souza, I see you got your hand up. Please unmute, and happy to hear your question. I see your question around multiculturalism in the chat as well. Okay. Go ahead and ask your question, Naomi.
Are there plans to change some nursing policies where staff don't come directly from a 7-hour shift in one home to Providence Villa when they're tired? I am aware of many staff that keep a taxi waiting, and then they come from one thing and then go to Providence Villa and are dozing off in front of the computer. And then they say there's no good service. So there's got to be some policy to be able to restrict that.
That's a tough one, Melissa.
So Naomi, thank you for bringing that up. We certainly know that there are challenges with staffing long-term care homes. And one of the biggest challenges is that there was a lot of part-time jobs and not a lot of full-time positions. And so people have been working at multiple locations. And that really came to light during COVID when we had to stop people moving between homes. So one of the things that Pat is working on with the team is looking at how do we change our model so we get more full-time positions so that people don't have to go between different homes. The other thing that we are doing is working with our staff and trying to engage them in creating a healthy workplace. And part of that healthy workplace means that we make sure that they're well rested, that they have time between their shifts, that they have access to services that they need to support them. Having that healthy culture with our staff is really important to having a healthy culture with our residents. I don't know, Pat, if you'd like to add to that.
I'm sorry to interrupt you, but these are full-time staff. These are full-time staff earning big bucks. They're nurses also. And we can talk sometime and I can talk to you about it.
Thank you, Naomi, and I apologize if that's been your experience, but let's talk offline and we'll connect.
Sure.
And we'll hear a little bit more about what you can tell us around that.
Okay.
Thank you, Naomi.
Folks, we've come to the end of our scheduled time. We still have a couple more questions in the chat. Maybe I'll just ask for real quick hit answers from my team, and then I'm going to wind us down being respectful of everyone's time. In terms of the timeline from Frank, when are we going to be open for admitting new residents? We're currently planning for 2 years from now, subject to what happens in these projects. But Mike, would it be fair to say we're penciling 2 years from now?
Yeah, we have a 24-month development time, and I saw a question about when the RFP for architect will go out. That's going out this summer in the upcoming weeks. We're hoping that'll come out within the next month.
Okay. Carolina, are there plans to make the existing outdoor grounds pathways on the houses rehabilitative hospital more accessible to the residents and the patients that live at Providence 24/7? Currently, additional pathways are narrow and no access to picnic benches. Access to pathways, Melissa.
So the short answer is yes. I think this came from Carolina. We are working on making those much more accessible.
Are there people with multiple sclerosis in their 60s in long-term care currently? Ashley or Melissa? Ashley.
Yes.
Yeah, that's about all we can say. Of course,
yes.
But I will tell you that Unity Health is a world leader in multiple sclerosis care. And all that we're doing is to provide wraparound care, not just for people who need to be in hospital, but rehabilitation care, etc. So multiple sclerosis is something that we're very passionate about and very expert in at Unity Health. Last question. Is there going to be an in-house project manager overseeing the entire process from design to construction? Will the general contractor be awarded through Infrastructure Ontario, Mike?
Yeah, we've had some successful work with Infrastructure Ontario on some of our other projects. So far, from what we have understand, is that Infrastructure Ontario is not going to be involved in this particular project, but we're great with working with them either way. But this isn't the model that they're following for this project. And I'm very pleased to say that we do have an in-house project manager that is overseeing the project that has a lot of great experience in doing healthcare development. I'll just ask Ron Taylor to unmute and just say a quick hello so you can see who he is, but Ron Taylor is our project manager for this.
Thanks, Mike. And it's, as always, great to hear from the community, and I'm sure we'll be talking many times in the future.
Thanks tons, Ron. And wow, this has been a really rich session, chock full of fantastic questions. And I can see that people are really as excited about this as us, and excited about and as motivated as us to see us do a good job of this. So I really want to thank you for attending tonight. Stay engaged. We'll let you know how to do that. We'll keep you informed. I really want to thank Councillor Gary Crawford for joining us. Gary, many thanks for joining us. And thanks for your support right from the beginning. Gary has been quite keen on this project. So thanks tons for your support, Gary. I know this project is only going to enhance our collective work to make sure our community in East End has the best care experiences possible whenever you need our care. I really look forward to staying connected with each of you. And if you have follow-up questions, please don't hesitate to reach out to the contact information provided. So I hope the rest of your evening is enjoyable, folks. Be well, take good care, and many thanks once again for joining us this evening. And get your vaccinations.